For our presentation, Michelle and I chose the topic of helping students who experience disasters and post-traumatic stress.
What is post-traumatic stress disorder? Post-traumatic stress disorder, commonly known as PTSD, is a psychiatric disorder in people who have had direct experience or exposure or who have witnessed a traumatic event. It can affect people of all ages. Some examples of traumatic events that have been shown to produce symptoms associated with PTSD are as follows, but are certainly not limited to a serious accident, a natural disaster such as a hurricane, tornado, earthquake, fire, or floods, abuse, violence, or rape, and exposure to war. A few examples of traumatic events that are specific to children are school shootings, violence, or losing a parent or caregiver.
According to the Red Cross website, a disaster refers to a sudden or unpredictable event that causes severe detriment to a society, community, family, or individual. A disaster often causes individuals to experience loss and grief and the inability to cope by one's own means. A disaster can be a natural phenomenon, such as an earthquake or hurricane. However, we as humans can also be responsible for disasters. A few examples of human disasters are accidents or wars, or even something such as water contamination. Disasters can cause people to experience a lot of trauma due to possible loss of homes, possessions, economic strains, death or harm to family or friends, a need for change in schools, and a loss of social supports within the community. According to the article Children and Natural Disasters, climate change is one of the leading causes for disaster today. Roughly 175 million children are affected by natural disasters due to climate change per year. Disasters can cause a variety of effects, both long-term and short-term, on things such as physical and mental health. For example, physical health can be affected if someone is injured in a storm or accident. Mental health can be affected when someone has witnessed or experienced something terrible and does not have the means of coping with their experience. As stated in the article Impacts of Natural Disaster on Children, it's mentioned that roughly half of the people affected by disasters are children. It has been reported that children are more vulnerable after a disaster occurs. This is because they rely heavily on their caregivers for a number of different things, such as a means of obtaining food and water, help when they are ill, assistance with injuries, or even just a means of protection or offering a sense of safeness. During a time of disaster, it is extremely important for a caregiver to support the child to the best of their ability. There are many different ways in which PTSD may manifest itself. Some of the most common signs and symptoms of PTSD that one may see across all ages are trouble sleeping or staying asleep, nightmares, flashbacks, avoidance of certain things, including people, topics, or locations that may remind the person of the traumatic event that they experience. These are also known as triggers or trauma triggers. Changes in attitudes or behaviors, loss of appetite, which can also lead to weight loss, and difficulty concentrating. The previous slide discussed the more common symptoms of PTSD. However, symptoms may vary depending on the age of the person. For example, when working with preschool-age children, some things that you should look out for are crying or screaming often, loss of appetite, which can also lead to weight loss, nightmares, and trouble being separated from their primary caregiver. When working with school-age children, you should look out for things such as difficulty concentrating while in school, which can also lead to lower grades, trouble when it comes to sleeping. Some children may have difficulty falling asleep or staying asleep, and they may also experience nightmares or night terrors. The child may frequently feel anxious or scared, and they may also feel guilty or shameful, like what happened is partially their fault. When working with teenagers, some signs and symptoms that you should look out for are eating disorders, self-harm, depression, isolation. So maybe the person doesn't want to do the things that they used to enjoy, or maybe they spend a lot of time in their bed avoiding others. And finally, they may begin engaging in risky behaviors such as sexual behaviors, violence, or they may begin using drugs, alcohol, or tobacco products. So after reviewing the list of symptoms above, these symptoms can also be sorted into different categories. These different categories are arousal symptoms, avoidance symptoms, and intrusion symptoms. Arousal symptoms are things such as irritability, jumpiness, sleeping issues, or difficulty concentrating. Avoidance symptoms can include withdrawal, isolation, avoiding a particular topic that may remind them of a particular event that occurred. The child may stop participating in things that they used to enjoy, and they may appear to be extremely guarded. Intrusion symptoms include the unwanted memories or flashbacks, and nightmares or night terrors. There are a number of different things that you could look at to determine if a child is at risk of developing PTSD. The first is how close to the traumatic event the child was when it occurred. If the child watched someone get shot and killed 5 feet from them when they were walking home from school, obviously 5 feet is very close. Researchers would say that the child who was 5 feet from the event would be more likely to develop PTSD over a child who watched the video of the same event on TV or on social media. The next is the severity of the event. Let's say that a child was involved in a tornado and lost their home, all of their belongings, and their parents to this disaster. One could say that this child would be more likely to develop PTSD than a child who was on the outskirts of the storm and the roof blew off of their house, but everyone was safe and the roof was repairable. The third would be the duration of the event. For example, if a hurricane hit and lasted 5 days of pouring rain, heavy and damaging winds, and severe flooding, this child who went through that experience would be more likely to develop PTSD than a child who only experienced 1 day of the same storm. Fourth is the number of times that the event occurred. If a child is abused by their father and gets beaten 10 times per day, this child would be more likely to develop PTSD than a child who gets beaten 3 times per day. Next is if the child has affecting coping strategies. Some children may be able to develop their own coping strategies that they know that they can do if they experience symptoms. These coping strategies are things that for them they know they will be able to do, and they will help reduce symptoms and signs of their PTSD, or even if they are feeling a bit anxious. However, there are some children that are either too young to know what coping strategies are, or do not have any identified that work for them. Lastly is whether or not the child has a good support system. This support system can be family, friends, or their community. If a child has a support system that they know if they go to when they experience something traumatic, that system will help them. Then they are less likely to develop PTSD or experience symptoms.
Diagnostic criteria for PTSD. In order to be diagnosed with PTSD, one must have had directly experienced the traumatic event, must have witnessed in person the event as it occurred to others, or learn that the traumatic event occurred to a close family member or close friend. In cases of actual or threatened death of a family member or friend, the event must have been violent or accidental. And lastly, the individual must have experienced repeated or extreme exposure to aversive details of the traumatic event. Diagnostic criteria for PTSD in children 6 years and younger. An assessment for PTSD can be done as a face-to-face interview where the counselor would ask questions about the symptoms related to PTSD. Counselors can also refer to parents due to the fact that children do not always report PTSD symptoms accurately. In children older than 6 years, repetitive play may occur in which themes or aspects of the traumatic event are expressed. In criteria B2 of the DSM-5, it mentions that the presence of this intrusion symptom associated with the traumatic event or beginning after the traumatic event occurred, which is reoccurring distressing dreams in which the content and or effect of the dream are related to the traumatic event. In children, there might be frightening dreams without risk for disasters. Disaster risk is therefore considered as the combination of the severity and frequency of a hazard, the number of people and assets exposed to the hazard, and their vulnerability to the damage. Risks are assessed based on the following components: hazard, exposure, and vulnerability. Effects of disasters and PTSD. As mentioned in the article, Impacts of Natural Disasters on Children, children can suffer psychological harm from damage to their homes and possessions. Children's education can be interrupted from disasters as their families may be displaced, their schools may be destroyed, and children may experience more pressure to help their family provide financially. When a student is dealing with PTSD, their schooling and education can be directly affected. Some of the areas that may be affected due to a student experiencing PTSD are poor grades. You may see a child who was once a good student, who received good grades, suddenly begin to drop. Their overall GPA can also drop as well. The child may stop participating in things that they enjoyed to do, such as playing on sports teams, going on field trips, or spending time with their friends. For some children, it may be important that the counselor recognizes if the student has begun to stop participating in these types of things, as these may be stress relievers or coping mechanisms for them. Also, a lower IQ and lower reading ability, and the child may begin to be.
Though there are many examples out there of disasters that we could talk about, one example that we had found research on was Hurricane Katrina. After Hurricane Katrina hit New Orleans in 2005, researchers examined a sample of students on the status of their overall mental health. The researchers concluded that after the hurricane, children and adolescents experienced high rates of PTSD, as well as a number of other negative mental health impacts, such as depression or anxiety. They also found that in adolescents there was an increased rate of aggression. Researchers worked with parents of the adolescents affected, and parents reported that the behavioral issues did not exist prior to the storm. Earlier in our presentation, we spoke about how it is very important for caregivers to support children to the best of their ability during a traumatic or stressful time. In this particular article, they discuss how children tend to get upset, causing more distress when a caregiver's ability to protect the child is lowered due to an event. Also, if the caregiver is blatant about the stress that they are experiencing as well, this will affect the child and cause more distress. Usually with time, effective coping strategies, and therapy, symptoms of PTSD may reduce as time goes on. After Hurricane Katrina, of the children who were participants in the study, 28% of them were still experiencing symptoms. Unfortunately, after Katrina, the number of mental health professionals and counselors declined dramatically, causing a barrier for those who needed services.
Children may have different reactions when a traumatic event occurs. They may feel angry regarding the event. The child may feel angry because they do not fully understand the reasoning behind an event occurring. This is where answering questions that the student may have and educating the student is important. They may have recurring thoughts of the event or topics similar to the event. They may avoid the topic completely or anything that reminds them of the topic. And they may have disassociation or disconnection during or after. Multicultural considerations. A disaster's impact on children varies based on their prior exposure to traumatic events. Socioeconomic factors, age, gender, personality traits, cognitive skills, and relationships with their parents and families. A multicultural consideration related with the effects of Hurricane Katrina would be that the U.S. Government Accountability Office reported that the number of mental health professionals in the area declined substantially. With that being said, we can see how it would now lead us to think that if a child needed mental health services, they would face struggles obtaining access and dealing with the problems they are facing, thus meaning that if PTSD symptoms were present, it could be harder to keep them under control or prevent the symptoms from occurring if there is no professional help available. Another example of multicultural considerations that happened as a result of Hurricane Katrina is the effect on economic well-being within families. Due to immense disaster that occurred, many parents' location of work were affected. This prevented them from going back to work in a timely manner or needing to find a new place to work due to structural damages. Because of this, financial strain was a huge burden to many families who were affected by Hurricane Katrina. PTSD and the greater effect on females. According to the American Psychological Association, authors reviewed 290 studies to figure out who is more at risk, males or females. The studies used had been conducted from 1980 to 2005. The results showed that while men may be more at risk for experiencing traumatic events, females suffer from higher PTSD rates. From this, it was also found that females were more likely to have experienced sexual assaults and child abuse. With that being said, it is also mentioned that sexual trauma causes more emotional suffering and can contribute to a PTSD diagnosis more than other types of trauma.
Treatment options for children or adolescents with PTSD. Some of the treatment options that can be offered to a child or adolescent experiencing PTSD are therapy, play therapy, or medication. When it comes to therapy, it is one of the main treatments for PTSD. It is important for school counselors to remain educated on the signs and symptoms of PTSD in children and adolescents. If the school counselor is able to recognize the signs associated with PTSD, they will be able to start a conversation with the student. There are many times that a student may not want to initiate the conversation about what they are going through. This relates back to the symptoms of feeling shame or guilt. The school counselor may help the student understand and work through the emotions of what happened. They can help educate the student and help them develop coping skills or seek out further means of treatment. The school counselor may also help educate the caregiver or caregivers on the experience, as well as help them understand the child's way of coping. Working with the caregivers can also offer more support to the child. Play therapy is often used for younger children. Play therapy allows for children who have difficulty understanding what happened express themselves in a more comfortable way. Examples of play therapy can include art and games. Medication is also helpful when treating PTSD. There is not one specific medicine that treats PTSD, but there are several medications that can help alleviate some of the symptoms that someone may be experiencing due to PTSD. Antidepressants and anti-anxiety medications are two of the more frequently used medications when it comes to treating symptoms. It has also been found that if someone is taking medications for their symptoms, it will be most effective if the person participates in therapy as well.
Examples of positive coping strategies. The first example is relaxation exercises, such as deep breathing, meditation, or yoga. The second example is spending time with family and friends, or another support system. Third, thought stopping strategies from blocking intrusive thoughts. How would you want to stop your thoughts? You can start off by making a list of things that you feel are most stressful. These are thoughts that distract you from your daily activities and make you worry more. You wish you could stop having these thoughts, but they keep occurring. You can write down your upsetting thoughts in order of most stressful to least stressful. Another example is to imagine the thought. You can sit or lie down in a private place, stopping yourself, closing your eyes, and imagine a situation in which you might have this stressful thought. Then you can allow yourself to focus on a thought. Another method could be to stop the thought. Starting yourself is a good way to interrupt the thought. Fourth would be developing a routine. And lastly, getting rest and sticking to a healthy diet.
What can the school counselor do to help a student who may be dealing with PTSD? The first thing you could do is have a conversation with the student. Often, students may be hesitant to come forward and ask to talk or ask for help. It may be important that the school counselor initiate the conversation with the student to get the conversation moving. It will be important to be upfront with the student and let them know that you are aware of the event that occurred and you are there to support them with whatever they may need. The second thing that you could do is to corroborate feelings and experiences with the student. It is important that the student feels supported by the school counselor. This is where it is important to be empathetic towards them. The third is oftentimes students may have questions about the event that occurred. If this is the case, it is important to give accurate responses and information. It will be important to remember to use age-appropriate wording so that the student fully understands what you are discussing with them. Also, let the student, and if necessary, the caregivers, know that strong emotions are normal and their reactions are normal to what others who experience similar events feel, and that they should not be ashamed. Lastly, you can help the student come up with coping strategies that are both positive and effective. It may take a few attempts to come up with coping strategies that will work for the student, but it is important to not give up.
Overall, what we gained from this assignment was that it is important to take a closer look at things that can affect children based off their age and how they interpret their experiences.